Hello lovely people, welcome back to my channel. So in today's video we're going to be talking about halitosis, the medical term for bad breath. So we're going to be talking about the different types of halitosis, the causes of halitosis, and then the treatment that's available in your local drugstore or the treatment that's available at home for you to use to treat halitosis. If it's something that you're interested in, then I suggest you keep on watching this video. So halitosis simply means an unpleasant smell on your breath that can be noticed by other people. Normally the individual cannot notice the smell. There are three types of halitosis and I'm going to be breaking it down today. So let's start by talking about the physiological halitosis. So physiological halitosis is normally transient. What that means is it's normally around for just a short period of time. It can be caused by one, food that you've eaten, or maybe you're fasting, or maybe a morning breath. So when you sleep and you wake up and you have a morning breath, this is also known as physiological halitosis. So the second part of halitosis is known as psychological halitosis. So with psychological halitosis is when the individuals feels that they have halitosis, so they feel that they have bad breath, so they tend to cover their mouth when they're talking, or they tend to look away when they're talking to you. But then this individual do not have halitosis. So the third part, which is the pathological halitosis. So with pathological halitosis is normally caused by a medical condition. So an example of pathological halitosis is one, having gum disease, so gingivitis, or having a coating at the back of your tongue, or having medical conditions such as tonsillitis. So now I'm going to move on to talking about the causes of halitosis. So one, it could be poor oral hygiene. So if you're someone that do not brush the teeth effectively or frequently, then your chances of having halitosis is very high because of the growth of bacteria in your mouth. Again, if you're someone that's not flossing effectively or flossing at all, or using interdental brushes to get rid of food particles in your mouth, then you are at risk of halitosis. And people with gum disease, so when I say gum disease, gingivitis, people that brush your teeth and you bleed, you see blood, that could be a sign of gum disease. These people are at risk of developing halitosis. So again, it all stems down to having poor oral hygiene. Another cause of halitosis could be certain food, as I mentioned earlier. Foods such as garlic, onions, cheese, or even drinks such as alcohol can also have an effect on your breath. Another cause of halitosis could be dry mouth. You know that saliva clears away food particles in our mouth. We also know that it clears away any bacteria in our mouth. So not having enough saliva production can lead to halitosis. Another cause of halitosis again can be medical conditions. So medical conditions such as respiratory infections can lead to halitosis, and of course people that have diabetes as well are at risk of developing halitosis. So again, as I said, it's always important to know the causes of your halitosis. So let's move on by talking about how to get rid of halitosis or your bad breath. Making sure that you have a good oral hygiene. So when I say good oral hygiene, one, making sure that you're flossing every day or once a day, making sure that you use, even if you can't floss, you can use interdental brushes. You can find these in your local pharmacies. Making sure that you're brushing your teeth twice a day effectively. This can help get rid of the bacterial growth in your mouth, and it can help you get rid of your halitosis. Step 2, you can also buy sugar-free gums from your pharmacy. So when I say sugar-free gum, you want sugar-free gums that contains an ingredient called xylitol. Having gum in your mouth is so important because it increases your saliva production, therefore preventing any dry mouth. And again, this xylitol ingredient prevents any bacterial growth in your mouth, and of course tooth decay. Step 3, making sure that you're using mouthwash. So mouthwash, you want to get mouthwash that contains ingredients such as chlorhexidine, ingredients such as zinc chloride or fluoride. So these are effective at treating any gingivitis or any gum disease. So you need mouthwashes such as the CB12 mouthwash. Also get Clocidol mouthwash. Clocidol mouthwash contains chlorhexidine. So when you're buying mouthwash, make sure that you're getting the one with alcohol free. Let's move on by talking about using a tongue scraper. You can use a tongue scraper to scrape the back of your tongue, get rid of any coating at the back of your tongue. Make sure that you're not taking in a lot of sugary food. If you're going to drink fizzy drinks, make sure that you're not swishing it around your teeth. So if you've tried all these and it's not helping, and you feel like you still got halitosis, or someone is telling you that you still got halitosis, then it's worth paying a visit to your dentist. Your dentist will be able to check what's causing your halitosis. They'll be able to offer you treatment or a toothpaste for you to use. After that, if your halitosis is still persistent, then they may refer you to your GP, and then your GP will be able to look at what's causing your halitosis. Alright guys, so I'm going to leave this video here. If it's something that you find very, very useful, then please share, comment, like and subscribe. Don't forget to follow me on my socials. So it's Nana's Health Talk on Instagram, Nana's Health Talk on TikTok, and of course Nana the Pharmacist on YouTube.